Hello and welcome to this webinar on avoiding common graph errors in your magnet document. I'm Barb Haag-Heitman, a consultant with Nursing Consulting Partners. I've been a magnet consultant since 2006, and I'm also an author of several books and publications on peer review, professional governance, and professional practice development using Novice to Expert. You can read more about me and my colleagues at nursingconsultingpartners.com. Today I want to talk about graphs and identify the current 2003 Magnet Manual EO requirements and explain how to avoid some typical errors that we see. So this is the new magnet format for EOs. You'll notice that there is an addition in the pre-intervention area. So prior to this, it was you stated the problem and then you went into the goal section. You always reported data in the problem section that drove the intervention. In the new format, they ask that you do that in addition to a pre-intervention. So prior to establishing your goal, what was done, what data was used to identify the problem. Then you move into your goal, participant table is the same, and in the intervention, now you also are required to provide two key references. References within the time period prior to your intervention that could help inform the intervention. And then you also talk in another paragraph about how the intervention affected the outcomes, and then your outcome. So two additions to the format in the new manual. So EO equals empirical outcomes. There are more to them. There's a small change in format, and there's an emphasis on ambulatory. Note that there's an entire section in the 2023 Magnet Manual on writing to the EOs. It starts on page 23. So look there and look often and follow. There's examples there. There's also examples for some other EOs, so more specific EOs that I'll talk about at the end of the presentation. So I'm talking about these EOs that you find that in the domain sections, and they often start out with a number and identification of the section that they are coming from. So things that remain the same. The x-axis, that's that long axis. I think about the y as somebody standing up with their arms outstretched. That's how I remember the difference between the x and the y axis. That's your unit of measure. It's the same as in prior graphs. So you put in the rate, the mean, the median, or the percentage. The data cells, they're the same. They need to be sequential, and there's often errors made there. And the implementation time we're going to talk about, do you put data in there or no data? And that's really a preference of your organization. I'll talk about that a little bit more. So the graph displays that are different are around the x-axis. The x-axis is at the bottom in the 2019 manual. In the description of the x-axis, you put the location of the data. In the 2023 manual, the x-axis requires the outcome measure. Again, take a look at the manual and be very cautious when you're looking at documents that were submitted before the 2023 requirements. So there's really four common errors. The first being that they weren't labeled correctly, starting with what you see here, the graph title. You need to label the graph title with the domain and the EO number. You specify the outcome measure and the location of the data collection. I'll show that a couple examples later on. And then you have your graph sections, the pre-intervention, the intervention, and the post-intervention. Those three sections are similar to 2019. When you look at the EO section in the manual, you'll also note that in their examples, that sometimes they've put in 2 data points in the pre-intervention. Not required, but kind of implied. So we do that when the data makes sense to present it that way when we work with organizations. So the 4 common errors: not labeling the pre-intervention, intervention, and post-intervention areas clearly with the right dates, not labeling the y-axis with the same unit of measurement as the goal. So there's error about if the goal was talking about decreasing the fall rate, then the graph has to be also labeled with fall rate, not the percentage. So just those little nuances, easy to do, but we'll really need a keen eye. The third common error: the dates are not displayed in consecutive time frames. They need to be days to days, month to months, quarters to quarters. Sometimes there are overlapping dates, or the dates don't match the narrative, or particularly when there's a change in years from like December to January, the year sometimes doesn't get brought over correctly. So take a look at that too. And then at times you'll see that process measures are presented versus outcome measures. So the process measure is the so what. If we do this evidence-based intervention, what difference does it make? For example, in the mother-baby units or perinatal units, skin to skin following birth is a process measure. It's an evidence-based practice, but it is not, you can't use your compliance with skin to skin as the outcome measure. The outcome can be things like exclusive breastfeeding upon discharge, a decrease in hypothermia, a decrease in hypoglycemia. That's what the evidence shows. Another common process measure that is used are compliances with aspects of the sepsis or the stroke or cardiac interventions. So for early sepsis intervention, the outcome is mortality, not the actual process measures that are specified in the bundle. So another way of thinking about the outcomes is what impact would happen if the interventions weren't put in place. So here's a couple of things. Wrong dates, didn't change the year from Q1 to Q2. Dates not consistent with the narrative. The post-intervention data doesn't outperform the pre-intervention data, so that's a requirement. Whatever you're trying to measure, if it's supposed to get better or decrease, you need to see that the data supports your goal, or the graph's not aligned with the goal. So there's a mistake. Sometimes it's the unit or the measurement labeling of the y-axis as I described. So let's take a look at a couple graphs. This one meets all the requirements, starting with the graph title. So you'll see it's SE for structural empowerment. Example 1, it's EO and it's A. There's 2 parts to this one. There's the measurement is provided and the unit where the data came from. Now let's look at the graph itself. The y-axis is the average length of stay in days. Then we see that across the top, we see the pre-intervention, intervention, and post-intervention clearly marked. I'm going to show you some variations on that. So there's no real prescription for that, except they have to be labeled. Again, I'll show you a couple ways that people do it. And then in the y-axis, we look to make sure there's sequential data that matches your goal. So you'll see in the x-axis labeling, it's the 5 north average length of stay in days. And then you see a progressive decrease in the average length of stay. Note, in the intervention period, there is no data in the x-axis. We actually prefer that. That's a recommendation in our consulting group. You can put data in there, but it's not required. So let's look at another graph. This graph also has the requirements in terms of the graph title. So this is from NK, the new knowledge section, ADOB, and you see their goal was to decrease the average cost in dollars per month per EDRN inpatient delivery of specimens to the lab. So, and again, this came from the emergency room. So their y-axis is in dollars, and their x-axis is in the RN cost of delivering specimens. So this was a workflow example, a redesign of a workflow example in the ambulatory area. So you notice across the x-axis, again, the intervention period is left blank in this example. You see that the pre-intervention, intervention, and post-intervention are labeled a little bit differently than they were in the last graph. And you see a decrease or a reduction that matches the intent of the work or the goal. Well, let's look at one that doesn't meet the requirement. I'm wondering if you could spot the error. Well, the first error is in the title of the graph. So we don't know what example this came from. We do know what the goal was, and this had to do around the customer experience. How would you rate the courtesy and friendliness of the staff? The location we can assume is the ED, but you would want to put that as your third row on your graph title. So the source of evidence, the measurement, and the location in the title. When we look at the y-axis, that's the mean score, and we see on the x-axis that we have the actual measure. And then you'll see that they wanted to increase because this is patient experience data. And you'll see that their starting point was 4.47 in March 24, and it's steadily increased over time. They put in a trend line to show this increase. That can be handy when it's just a small incremental increase, but not required. Again, you see the labeling of the three sections just a little bit differently. Let's look at another one that has errors. Can you spot the error here? So you'll see that, as we discussed in the last slide, that the graph is not labeled correctly, doesn't have all the requirements, lacks the number, lacks the location. There's no label on the the y-axis. And when we look at the data periods, you'll see the error, that this was in January, the pre-intervention, the intervention continued in January or February to May 23. And then there's a data point that has June 24th, and then back to July 23. So the year is wrong on this one. It's very common. I recommend that you have more than one person look at your graphs before you submit them, and look for all these errors. Then we have the unique EO examples. They have their own requirements. Again, look in the magnet manual and for the specific requirements related to these: the certification, the BSN and higher, RN satisfaction, RN turnover rate, nurse sensitive indicators. Those are the quality indicators, both ambulatory and inpatient, and the same for patient experience, ambulatory and inpatient. So again, these are unique EOs. They have their own formula. We also recommend that for these unique EOs that you use vendor graphs whenever it's possible, particularly for the nurse-sensitive indicators that are quality, the patient experience indicators, and the RN satisfaction. And the reason for that is that you need to do a verification of the data source when the magnet appraisers come. It's easy to do that verification when you use the vendor graphs, and the vendor graphs are set up to give you all the information that you need to meet the requirements of those examples. So that was a quick tutorial on common errors to avoid. We have a variety of services to support your magnet journey, including the readiness assessment. We do document writing. We do editing. We'll do my site review or preparation. We do work around governance, redesign, peer review, and we have some new AI-supported technical tools. If you're interested in getting our help with the graphs, we do have a specific consulting service related to that. I'd be happy to discuss that with you. And then I just want to tell you about the top reasons for choosing nursing consulting partners. It's nurse-owned and operated, nurse-led. We have a 100% client success rate. We're the longest-running magnet supporter. We were established in 1996. We have nurse experts who can write your document, and we have experts all across the United States and some international too. And we're your best value solution when you look at our competition. We have fair pricing and a best value. So thank you for your participation. If you have any questions, comments, or would like to talk to us more about our consulting services, please give us a call. Contact us at nursingconsultingpartners.com.